A new clinical trial is looking at the use of pacemakers as a way to help control high blood pressure. We learn more from Dr. Rahul Doshi. He's an electrophysiologist at Scottsdale's Honor Health Research Institute. Doctor, thank you so much for joining. It's good to have you on Arizona Horizon. Let's start with the basics here. What is a pacemaker?
So a pacemaker is a fully implantable electronic device that is basically designed to keep people from having a slow heart rate. And so it sort of can look at your own heart's electrical activity, which coordinates how the heart contracts, and then kind of fills in where you don't. So if you have a tendency for slow heart rates in the upper chambers, slow heart rates in the lower chambers, both, the device can literally see that and stimulate the heart to cause a heartbeat.
Okay, so that's a pacemaker.
Mm-hmm.
How in the world is there a relationship between what you just described and blood pressure, and especially high blood pressure?
Well, I'm glad you asked. So this is very novel and wonderful new technology that we're investigating at the Honor Health Research Institute. The device is a traditional pacemaker, so that's the first part of it. These are for folks that are indicated for pacemaker implantation, so they typically have a tendency or have a chronic slow heart rate problem. But a pacemaker, all pacemakers coordinate electrical contraction between the upper and lower chambers. So you've got these two upper chambers, the atria, the two lower chambers, the ventricles, and these work together to coordinate a normal heartbeat. The timing between the upper and lower chambers can actually affect someone's blood pressure. So both by changing how the heart fills up with blood and then ejects it, by modulating how the body thinks it needs to regulate blood pressure, varying that timing actually causes that change. And so this novel technology essentially varies that timing between the upper and lower chamber contraction, and this has been demonstrated to reduce blood pressure.
So is there something inherent in pacemakers that can control blood pressure?
No, not at all. So a standard pacemaker does not do this. But this investigational algorithm, and it really is just an electronic algorithm,
yes,
something that's programmable into the device, allows you to do this.
And these are finely, I would imagine, are they individually tuned algorithms, or is this a general algorithm?
Yes, it's both. There is a general algorithm, but it is fine-tuned depending on the response of the individual patient. And the key part here is that, remember, this is doing it automatically, beat to beat, and thus affecting blood pressure in real time without medications, right? So many folks take medication upon medication for high blood pressure and still don't have adequate control. So we're really excited about this technology.
So these, again, are these special and or specific pacemakers, or is this your general run-of-the-mill pacemaker here?
You can think of it as both. This is a run-of-the-mill pacemaker that we implant every day in folks. The pacemaker is made by the biggest pacemaker manufacturer in the world, Medtronic. But the algorithm that varies that timing, that's what's investigational, and it can be only uploaded in patients that are in this clinical trial.
Yeah, and that's what you're studying right now.
Absolutely.
What about folks that have a normal heartbeat, that don't need a pacemaker? Can you put a pacemaker in there if they have high blood pressure?
That, of course, is the million-dollar question,
yes,
or God knows, given how much blood pressure affects folks, it's probably a billion-dollar
yes,
question, right? Of course, that's something that can be investigated in the future, but the first premise, because, of course, everything we do in medicine is do no harm, so these are patients that are indicated for a pacemaker, they're getting one anyway, and thus they're not undergoing an additional risk of an invasive procedure. If this works, you could imagine this
yes,
could be used as standalone therapy.
I was going to say, I mean, the invasive nature of getting a pacemaker, does that supersede the problems that can be had when your blood pressure is sky high?
Well, I'll tell you what, full disclosure here, as an electrophysiologist who puts in pacemakers every day and has been doing this for many, many years, yeah, of course, to me, I think it's a relatively straightforward thing. And yes, I think the data would suggest that they are such safe devices to implant. They're becoming more and more, or I should say less and less invasive. And so I do think you could see a place where the risks clearly are outweighed by the potential benefits. And so I could see that happening, absolutely.
For those in the trial, have you, I mean, what happens if they're just overloading with salt and overloading with kinds of things that naturally raise blood pressure? Is that, how does that work?
So obviously these are factors that we don't know truly what the interaction between all these other factors, different types of medications, things like diet or other things that can affect blood pressure, how they interact with this technology, but they certainly cause increased blood pressure. And so part of any blood pressure treatment regimen is multifactorial.
Yeah.
It is diet, it is exercise, it is taking your medications as prescribed. But it may be also something like this if this works.
So last question here. The clinical study is at what stage now, and what's next? What kind of time frame you got going?
So very proud of the Research Institute at Honor Health. We have a variety of clinical trials, and this is one of the trials that is now ready for enrollment. So we are actively screening and recruiting patients for enrollment. So if a patient meets the appropriate criteria, which of course, again, includes you need to be indicated to have a pacemaker implanted, you need to be on a medication for blood pressure, and yet your blood pressure is still too high, those folks can be enrolled in the trial, and there's a lot of those folks out there.
How can people get more information on this?
They can contact the Honor Health Research Institute or anyone in the electrophysiology section at Honor Health in the Cardiovascular Center of Excellence.
Well, it's fascinating. And again, when do you think you might start getting some real serious data out of this?
It depends on how quickly you enroll, of course,
Yes.
right? So I would anticipate, however, we're going to have some preliminary results as early as next year, and then we'll see with long-term follow-up.
Dr. Doshi, thank you so much for joining us. Great information.
Thank you so much for having me. It's a pleasure.
You bet.